Day. My name's Greg Kerbrock. I'm the Key Accounts and Government Account Specialist for Take Care. We're going to spend a little bit of time going through the plan summaries for the PPO 1500, HSA 2000, and the RSP plans. For the PPO 1500 plan, there's a deductible of $1,500 for an individual and $3,000 for a family. The out-of-pocket maximum limit, which is a financial safety net for you, is $3,000, including the deductible, and $9,000 for the family. Under this plan, all preventive services are covered at 100%. There is no deductible, so you can get your screenings done, your annual physical exam, at no out-of-pocket cost. However, if you are not feeling well and you need to see a primary care physician, you only pay a $5 copay if you use the FHP Health Center, a $10 copay for any of our preferred in-network providers, and a $20 copay if you use any of our other in-network providers. Specialists, those visits are covered at 100% after a $40 copay, and laboratory services are covered at 100% for routine exams and a $20 copay for specialty. If you need a X-ray done, you can have that taken care of at FHP Health Center for a $10 copay, or if you use any of our other in-network providers, you pay a $20 copay for that exam. If you need a more sophisticated diagnostic test like MRI or CT scan, those are covered at 80% after you've met the plan deductible. If you have an emergency room services are covered at 80%. Or urgent care services are covered under a $50 copay. As an inpatient hospital patient, you pay a 20% co-insurance amount, with the plan paying 80% after you've met your deductible. And for prescription drugs, there are a number of different rate tiers based on the type of medication you're getting. So for generic medications, you pay a $15 copay for a 30-day supply. However, you do get a price break of a $10 copay for those generics if you use Kmart, Superdrug, or any of the mega drug pharmacies on Guam. For brand name medications, you pay a $30 copay for a 30-day supply, or $100 for a 30-day supply for non-formulary medications or specialty medications. You can really save a lot of money by using our mail order program, where generics are available at a $0 copay for a 90-day supply, or name brand medications are available for a $30 copay for a 90-day supply. You can also get non-formulary medications through mail order. A 90-day supply is $100. All right, let's flip now to the HSA 2000 plan. Under that plan, the deductible is $2,000 for an individual or $4,000 for a family. However, if you are on class 2 through 4, once you've met an individual deductible of $2,800, then the plan kicks in its share of costs once you've met that deductible amount. Your out-of-pocket limit under the HSA 2000 is $4,000 for an individual or $12,000 for a family. And like the PPO 1500, the preventive care benefit is 100% covered for all of your preventive care services. Under the HSA 2000, all of the other benefits that are on the list here are subject to the deductible except for emergency room. So for instance, under primary care, if you use FHP Health Center under the HSA 2000, you pay a $5 copay, but that's after you've met your deductible. You pay a $10 copay for our preferred in-network providers, again, after you've met the deductible, or a $20 copay for any of our other in-network providers after you've met the deductible. Specialist care is $40 after the deductible. Laboratory services are 100% covered for routine Specialty is a $20 copay, again, after you've met your deductible. Outpatient X-ray, $10 at FHP Health Center, and $20 at other providers in our network after you've met the deductible. And MRIs, CT scans, those are all covered at 80% after you've met the deductible. But if you use an emergency room under the HSA 2000, that is covered at 80%. There is no deductible for the emergency room benefit under the HSA 2000. Urgent care is covered at 100% after a $50 copay, again, after you've met your deductible. And inpatient hospital services are covered at 80% once you've met your deductible. Prescription benefits are similar to the PPO 1500. The only difference is that you need to meet the deductible first before any benefits kick in. And the same goes for mail order prescription coverage. Now, there are some other benefits that you get on these two plans. For example, any preventive medications, statins, insulin, blood pressure control medications, those are all considered preventive medications, and they're all covered at 100%. Under the PPO, that plan, you don't have to meet a deductible for that coverage, but under the HSA 2000, you do need to meet the deductible first before that benefit level kicks in. Under both plans, both PPO 1500 and HSA 2000, you do get a Philippine provider executive checkup benefit of up to 17,050 pesos, which is around $380 US. You also get 100% coverage when you use our in-network providers in the Philippines once you've met your deductible under both plans. There's also a $150 optical benefit covering eyeglasses and contacts under both plans, but under the HSA 2000, you need to meet the deductible first. And then both plans do have our $500 travel allowance benefit subject to the deductible if you're under the HSA 2000 plan. Both plans do have a non-participating provider benefit, and the next two slides will be going over that. So under the PPO 1500 plan, if you use a non-participating provider, the deductible is $3,000 for an individual, $9,000 for family. There is no out-of-pocket max limit. There is no financial safety net when you use a non-participating providers. And preventive care is not covered under the PPO 15 if you use a non-participating provider. Primary care, specialist care, labs, x-rays, diagnostic testing, all of those are covered at 70% of eligible charges after the deductible. And you're going to be responsible for paying any excess charges in addition to the eligible expenses. Emergency room is covered at 80% with no deductible. Urgent care, inpatient hospital, again, 70% coverage after the deductible, and you're also responsible for any charges in excess of our eligible expenses. And prescription drugs are covered at 70% of MPA after the deductible. Mail order prescriptions are not covered on a non-participating basis. Under the HSA 2000, the deductible for non-participating providers is $4,000, $12,000 for a family. There is no out-of-pocket max limit. Preventive care is not covered. But unlike the PPO 1500, the HSA 2000, if you use a non-participating provider, the benefit is 50% of eligible charges after that deductible for primary care, specialists, labs, x-ray, and diagnostic testing. Emergency room, even if you use a non-participating provider, is covered at 80% with no deductible. But then we're back to 50% of eligible charges after deductible for urgent care and inpatient, hospital, and prescriptions are covered at 50% of MPA after the deductible. Again, mail order prescriptions are not covered out of network under the HSA 2000. So we'll spend now a little bit of time talking about the retiree supplemental plan. So this plan is meant to be a supplement to Medicare A and B. And in most cases, your Medicare coverage is going to be primary, and this plan will pay secondary to Medicare. Services that aren't covered by Medicare but are covered by this plan should be received by an in-network provider. And in this case, this RSP plan will pay primary. Any kind of out-of-network services not covered by this plan will not be covered unless it's been referred or pre-approved by an in-network provider. If you're out of our service area, you do require a referral from your doctor and prior authorization from Take Care. When Medicare is not payable outside of the US, for instance, in the Philippines, covered services under this plan are paid primary and based on the benefits that are listed. The RSP plan does cover preventive care at 100%. And for most other services like primary care specialists, lab, x-ray, and urgent care, this plan pays your Medicare Part B deductible and the 20% coinsurance. Outside of Medicare, then this plan pays 80% of the eligible charges when it's been pre-approved by Take Care. Emergency rooms, inpatient hospital, diagnostic testing are all paid by the plan at 80%. You pay 20%. Prescriptions under the RSP plan are covered for a 30-day supply with a $15 copay for generics. But if you use Kmart, Megadrug, or Superdrug, you only pay a $10 copay for those generic medications. Name brand medications are covered under a $30 copay, and non-formulary are covered at a $100 copay, as well as specialty medications, a $100 copay for a 30-day supply. If you need to have a prescription outside of Guam, CNMI, or the US, you're responsible for 20% of that medication costs. Like our other plans, if you use our mail order program, you do save a substantial amount of money. You can get a 90-day supply of generic medications with a $0 copay, or a 90-day supply of name brand medications for a $30 copay, or non-formulary medications for a $100 copay for a 90-day supply. Our retiree supplemental plan does include other benefits, such as a $150 optical benefit for eyeglasses and contact lenses. You can avail of our $500 travel allowance benefit. You also have access to our no-cost wellness programs and incentives, and our no-cost gym membership if you've elected that benefit.